Good afternoon. Welcome everyone to our Pickens County Community Meeting here today. It is Thursday, May 7th, and we're going to be discussing our roadmap to reopening. I hope you and your families are all staying safe and healthy, and I trust getting out and enjoying more activity in this wonderful weather. Not only are the seasons starting to change, but we are also transitioning in our response to the coronavirus emergency here in Pickens County. We're moving from a full stop stay-at-home order to starting to open up and allow more activities to happen in our community. This is exciting for people who need to get back to work, for people who maybe have had postponed elective surgeries that they're looking forward to taking care of, for those of us with just some general restlessness who have remained hopeful about getting back to a more normal life. And this is a significant change, and it's directly attributable to all the hard work and dedication and frankly sacrifice that you've all made over the last 8 weeks in response to this coronavirus emergency. It also means that our response team will be transitioning, and the people that you will hear from will start to look different, even starting today. And this is totally normal in an emergency response. We are moving from a structure where our incident commanders were making the decisions, which they did immensely successfully in a very fast-moving environment and really in the face of a huge threat, to one where now you're going to hear more from our Board of Health representatives who are going to be making decisions and weighing in on how we phase out of this emergency. These decisions will continue to be supported by our public health experts and our medical team, and supported by our staffs at the Emergency Operations Center. And those are the teams that really are pulling together all of the resources for things like our Emergency Assistance Fund and food banks, making sure that our healthcare and testing capacity remains high, and planning for things like backup locations if we need to provide care for COVID patients who maybe are finished with their hospitalization but need a step-down place to go home. And that's some of the type of work that emergency operations teams do. And we believe that we're ready to do this in a careful and measured way. We use the shutdown as time to prepare all of the resources that we need to take the incremental steps to open while still protecting your health and the health and capacity of our hospital. And that's what you're going to hear more details about in the next hour. And while I'm as anxious as the next person to, go camping or have a drink at the bar, I would be inauthentic if I didn't also acknowledge the worry that I have and that I know others in the community may share. There's still a real tension in our community between people who are very anxious to get back to more normal activities and get back to work, and people who are very scared that we're going to face another wave of the virus that we haven't yet experienced here. So we all still need to be precautious. Our personal responsibility matters now, maybe more than ever, because we're going to be doing more activities, seeing more people, going more places, and the virus is still in Colorado, it's still in the US, our elderly are still at risk. So we need to continue to care for each other. You're going to hear about the commitments of containment that you're going to be continued to ask to do for the foreseeable future. And even as we're doing more, we need to remain even more vigilant about taking care of each other. So to get started here with our presenters, I'm going to invite Aspen Valley Hospital's CEO, Dave Ressler, to come on the line and join us, please.
Good afternoon, Pickens County. This is Dave Ressler. I'm the CEO at Aspen Valley Hospital, and it's a pleasure to be talking to you again about our progress, both at the hospital and in our partnership with Pickens County Public Health and in the community. Let me start. I just have 3 updates with the fact that Aspen Valley Hospital and our clinics, we resumed our elective services on May 1st. And it has been going very well. We are providing these services safely for our patients. We continue to protect our staff and maintain our readiness. And I'll tell you, there's a palpable excitement in the hospital as our staff is back to doing what they love to do, which is take care of patients and provide extraordinary care. It's what we do. and it feels very good to be resuming these services in a limited fashion and carefully. But it's great to see patients in the hallways a little bit more than we have for a while, and being able to do for the community what it needs, and that is to provide those essential healthcare services that many of our community members have been waiting to receive, that may not have been urgent or emergent, but that are essential nonetheless. And so we continue to be here for the community, and we're still here for those that do have COVID symptoms, and we separate that population of patients and provide extraordinary care to them while we're keeping the rest of our patients safe. So it's very exciting for our staff, and this is the beginning of Nurses Week, started yesterday. So thank your nurses, our nurses in the community, and the other healthcare workers that take care of all of us. The second update I have is that our testing is also going well, and as you've heard so much about, we're the first step in that box it in strategy that is part of our roadmap to reopening. And in the past 2 weeks since we commenced, it'll be 2 weeks tomorrow since we commenced this community testing. So as a reminder, we've been testing patients all along, but this is testing that we're doing specifically for the purpose of patients that have minor symptoms to determine if they have the virus, so that they can then be part of the tracing process to contain the virus if they have it. So we've tested 38 people in the last 2 weeks, and we still have a couple tests outstanding, but we've only had 2 positive results. So that continues to be a very low incidence of the virus. Plus, we're seeing very few patients approaching us for medical care in our respiratory evaluation tent, the emergency department, or they're being admitted. We still have 1 or 2 a day, but again, this was the time to be able to implement this process, and we're very proud to be partnered with Pickton County Public Health in being the beginning of the testing and tracing process. So once again, as a reminder to our community members, if you have symptoms or believe you have symptoms, call your primary care physician. If you don't have a primary care physician, call us, and we'll be happy to talk to you through our primary care practice. But that primary care physician, either yours or ours, will refer you to the tent, we'll schedule an appointment, and we'll conduct the test. So that is something we encourage everybody to do. And please, if you do not have insurance or you're worried about the cost, there will be no cost to the patient. If you have insurance, we will bill the insurance because we think it's only fair and appropriate that they pay their share, but the patient will not have a cost associated with community testing. We want everybody to be tested. That's critically important to moving forward and our roadmap to reopen. My third update is how pleased we are and honored to be participating in the roadmap process in a couple different very important ways besides just the testing. And that is, number one, data. So as you're going to be hearing from John in a minute, this is a data-driven process as the community reopens, and the hospital provides regular data feedback to public health regarding the numbers of patients that we're seeing and the types of patients we're seeing, the testing results, et cetera. So we're very happy to do that, and we continuously update that process to make sure we're providing timely and accurate data. The second way in which we're supporting the process is through recommendations from the hospital and our medical staff. And we have a group of physicians called the Medical Advisory Team that was organized by Dr. Kim Levin, who is the public health physician. And they meet, and we, I should say, meet regularly and review recommendations by public health and provide physician and hospital input, which includes a lot of science and as much data as we can possibly provide, and some recommendations to support the very difficult decisions that need to be made by ultimately the Board of the Public Health Board. So the Board of Health. So we are very pleased to be participating in that process, and we really appreciate having a voice and have all along, because we're downstream from whatever these decisions result in terms of potential viral spread. But we also, as a medical staff in a hospital, are so invested in getting this community going again safely and getting the economy restored that ultimately benefits our families and the vitality of our community. And we're part of that community. So it's such a privilege to be participating in that process. So that is all I have to say for today. And I will now, I believe, turn it over to John, who is going to talk more about the roadmap to reopening.
And I'll just jump in here. So we're going to move on to John Peacock, our county manager. And I was remiss for those listening at home, your moderator. This is Kelly McNicholas Curry. I'm the vice chair of the Board of County Commissioners. So John Peacock, please go ahead, take it away.
Thank you, Kelly, and thank you, Dave. Again, this is John Peacock. I'm the Pickens County manager. And I want to start off with a huge thank you to this community. We have gone through an incredibly difficult phase of fighting this virus, and we're winning. That's what our test results that Dave talked about show us. That's flattening the curve. We've had a lot of success in accomplishing that, and that's something that we've done together with cooperation of the community, so thank you. And we're really excited to be talking now about our roadmap to reopening. And it starts with our continued commitment as a community to fighting this virus. And that means we need to make 5 commitments to each other and to our guests. And that is that we're going to maintain physical distancing standards, that we're going to maintain the strong hygiene practices, the simple act of washing and sterilizing our hands. It's helping us win. Wearing face masks when you can't be 6 feet apart and in buildings. If you feel sick, if you have any symptoms, stay home. Stay home. Call your primary care physician. If you don't have one, call the hospital, as Dave just said, to be tested. This is the only way we continue to bring this fight to the virus, because once we know who's infected, then we can reach out to all the people that you've had contact with or that an infected person has had contact with and get the virus isolated so that it does not spread in an unmitigated way in our community. So we need to make those 5 commitments to each other so we don't have to go back to these really difficult public health orders that keep all of us at home and sometimes from our work. The county, in working with our partners, we've identified a 3-phase plan for reopening. And the first phase of that plan will start on May 9th. Jordana, who's speaking soon here, will be talking a little bit more about what that looks like with the new public health order. And if you want to see this roadmap to recovery, you can find it on Pickens County's website, www.pickenscounty.com, and click on COVID information. There's a lot of data there about what the phases look like. What's really important, though, in addition to the commitments that we need to make to each other, is we're going to be looking at 5 criteria for moving between those phases. As Dave said earlier, this is a data-driven process. And so we're going to be looking at what's happening with infection rates. We're going to be looking for infection rates to have decreased for at least 14 days prior to moving to a next phase. We're going to be watching not only our testing data, but our symptom tracking data. We're going to be watching how cases are coming into the hospital. We also want to be sure that the hospital is able to safely treat patients and does not reach any type of crisis level because of the number of infections and serious illness caused by COVID-19. And so we're going to be looking for those forward indicators of hospitalization and hospital capacity. We're going to be tracking to make sure that testing is performed for all people with symptoms for COVID-19 infections. We're going to be sure that there's active and timely monitoring that can be accomplished for all COVID-19 cases and their contacts. That's the contact tracing that we keep talking about. And we're going to continue to work to have clear protocols for our businesses, for our residents, for our guests. We need to make sure that we have clear protocols and that we're all encouraging each other to follow them. So this is really our roadmap to reopening. This is our roadmap to more normal levels of activity. And again, this has only been made possible because everyone's been willing to really follow the public health orders and to follow these commitments to each other to stop the virus in its tracks. We can't slow down now. We got to keep doing that. We're going to have an incremental phased reopening of activities. We're going to track the data and we're going to report the data, not only to decision makers, but the public. So again, thank you as community members for all you've done. And we look forward to continuing to take this fight to the virus through our roadmap to reopening. And Kelly, with that, I'll turn it back to you.
Okay, thanks, John. And I'm going to go ahead and ask Jordana Sabella from our public health team to please go ahead and join us.
Thank you, Kelly. Again, this is Jordana Sabella from Pitkin County Public Health. I'm the Planning, Prevention, and Partnerships Manager there. And today I'm going to be talking about our new public health order. I'd like to share my screen if the host can give me some permission to do that. To really talk through what this new public health order that will be coming out on May 9th is going to entail. So, make this larger, and then we're going to really, that's beginning here, and we'll talk through what's changing on May 9th. We're going from the stay-at-home order, which was really an order to stay at home, to the safer at home, which is really a little bit softer, where there's recommendations to stay at home as much as possible. So John talked us through these 5 criteria that were met, which allowed us to move, which is going to allow us to move to this next phase on May 9th. On May 9th, we're moving from this suppression strategy that we've had in place before, which is extremely restrictive, to loosening some of these measures. And for this to be able to really be effective, we have these 4 things in place that we need to continue to do. So testing widely, which Dave and John have talked about, and we'll continue to reiterate the importance of that. Once folks are that do test positive for COVID-19, we're making sure they're isolated right away. We have that contact tracing team in place to find everyone else who's been in contact with them, quarantine them, to see if they develop symptoms, and if so, we can stop the virus there and box it in and continue that testing strategy going forward. And so here are some numbers. I know that it's mentioned if you do have symptoms, one of the most important things that you can do is to get tested right away. So you can call your primary care doctor that you already have a relationship with, or the number at Aspen Valley Primary Care is 970-279-4111. And Dave reiterated very nicely that if you don't have health insurance, there will be no charge to this. We really want everyone in the community to be tested. So this standing public health order that's going to be coming out and will be changing on May 9th. Biggest point here is that we're really aligning with the state safer at home order. We're going from a gathering size of 5 to 10. You'll still need to have all of the social distancing measures in place. You're encouraged to stay home, which was different from before, where you were ordered to stay home except for doing these essential functions. What we'll see that's new is that businesses, other than essential businesses, which have been open this entire time, will be able to open with the completion of a COVID-19 business safety plan, which there are links to on the Pitkin County COVID website. Elective surgeries are allowed. Restaurants are open for takeout only. And the state is doing a really great job in providing a lot of guidance for these different industries that are able to now start opening under this new safer at home order. Face coverings are going to be required in the workplaces. That's alignment with the state, and we also have some local orders that then reiterate that. And we have the potential to move to the second phase of reopening on May 27th, pending we meet the criteria that John really discussed in detail. So this was just decided by our Board of Health meeting earlier this afternoon. And the Board of Health is also directing the staff to seek a variance for restaurants to potentially open at 30% capacity on May 20th. For this to happen, we need to have the Board of County Commissioners as well as Aspen Valley Hospital sign off on that variance before we send it to the state, and then the state has the ability to either approve or deny that request. So that's a process that will also be taking place. So what's changing? Again, the gathering size is going to be increased from 5 to 10 people. Businesses can open if they're compliant with that COVID-19 safety plan. We've had some really great open houses. We have hired a fantastic business liaison who's fielding a lot of these questions about what it means to any different kind of business who wants to open safely under the public health order. And the more information can also be found on the website. And we're also hosting open houses for business with different hours. Masks required in public buildings, and if you're within 6 feet of someone outside for longer than 10 minutes, that's something that is now required. And travel for recreational purposes should be limited to the Roaring Fork, Crystal, and Frying Pan River valleys. In the state order, they give the locals a little bit of guidance to say what that means for you. The state order says 10 miles or within your county, and because we know we've got so much traveled within our valleys and regions, that's what we really want people to be thinking about when you're thinking about where can I go for a hike, where can I go for a bike ride, is to let's stick within our community, that Roaring Fork, Crystal, and Frying Pan River valleys. So the isolation order. When folks have tested positive for COVID-19, it's required that they stay home until they have had no fever for 72 hours, so for 3 full days without taking any fever-reducing medicines, until all of their symptoms are improving, and at least 10 days have passed since their symptoms first started. And so this is just change. It used to be 7 days was the guidance. The CDC has now said that the best guidance is 10 days. So we've updated this order to reflect that. The other thing that's going to be changing in this May 9th public health order is that non-resident homeowners are no longer going to be required to quarantine for 14 days upon arriving to the county. So we've recognized that this was really, it was a challenge in communication. It was a challenge for law enforcement And we really have the ability now to use that box-it-in strategy and make sure that everyone who comes back into the county, whether you're a resident and you've traveled somewhere, that you're being safe, you're making good decisions, and that if you do get symptoms, you're going and getting tested right away. This is our new box-in strategy that we now have the capacity and capability to enact throughout the community. So what's staying the same? We're still not opening up short-term lodging. So right now, lodging of 30 days or less is not permitted. Social distancing is still in effect, that 6 feet, keeping 6 feet between you and anyone else around you. Staying home if you're sick and getting tested if you have symptoms continues to be extremely important. You're encouraged to stay home. You're encouraged to limit your travel to necessary travel. Restaurants are still open for takeout only. No indoor or outdoor seating is available. Permitted construction can continue to operate with the submission of their COVID-19 site safety plans. Those are going through the municipalities where they hold the permit. Landscaping and construction that doesn't require a permit continues to need to have a COVID-19 business safety plan. And golf courses have also had their COVID-19 business safety plans approved. So those requirements continue to stay the same. For more information, you can visit, again, the pitkincounty.com/corona website. And there you'll find the roadmap to reopening, information about businesses, as well as the new public health order that will go into effect on May 9th, which we are still finalizing and should have up there in the next few days.
Okay, Jordana, is that all for your presentation today?
That's it.
Okay, thank you so much. It's really nice to see you, and thank you for, I know, all the tireless hours that you have put in over the last 2 months. So we're going to dive in a little bit deeper to the business safety plan that Jordana referenced, and I'm going to invite Kara Silbernagel of our administration team to join us.
Thank you, Kelly. As she said, my name's Kara Silbernagel. I work in Pickens County Manager's Office. I'm the Policy and Projects Manager, and I've been working really closely with Jordana and the Public Health team on this roadmap to reopening. And so today I'm going to walk through a little bit more and dive into the details of this business safety plan checklist and what actually is required in order for businesses to open per the guidelines that Jordana just walked through under this new public health order. So with that, I think, Andrew, can you share the screen? Can you share the PowerPoint again? And jump straight to slide 7. So on the roadmap to reopening, which is on our Pickens County website, you'll also see links to this icon that Andrew just went through. You can go up to the other one, which really is the business safety plan checklist. And on that is a link to the to a Google Doc that is basically the reference document for the business safety plan checklist. And you'll see it's about 3 or 4 different pages and has several different elements in it to ensure that the protocols that we are managing as a community and other businesses are maintained. And I want to take a little bit of time to walk through what's in those sections and why they're there. I think
Kara,
it's really
can I jump in?
Remember.
I just want to make sure we're on the right slides for you.
Oh. Yeah, can you go up, Andrew, to the other? Yeah, thank you. Thank you, Kelly.
You bet.
And so I want to hit on a couple points that I think all the panelists today have hit on, which is these protocols are in place as part of the strategy, but it's also for us as a community to recognize that we're taking this seriously collectively as a community, and that all the businesses that are opening really are taking this seriously and want to maintain the health of all of the employees, the customers, and the broader community. And so one of the first things that you'll see in the business safety plan checklist is signage. So what is being asked is that as you complete the safety checklist, that you have that available and that there's appropriate signage for your employees and for customers, that they know that you have filed a safety checklist with Pickens County and are taking the necessary measures as we move into these new phases of reopening. Also included within the checklist is areas about how are we protecting employee health, having these conversations with the employees of what it means to stay home when you're sick and not compromising those of your fellow employees and customers as well, and the community. And then just how are we really reinforcing the concepts that we have been talking about collectively for the past 3 months, really, which is talking about washing your hands, making sure that hand washing stations are easily available, that we're reducing contact surface areas and trying to really remove those touch points that throughout all the various businesses. And really also then speaking about how are we improving the disinfection and increasing disinfection throughout all of the workplaces. These really continue to be the themes that we've heard from day one, and they'll continue to be the themes we hear from day 500 or whatever it may be. And so what are the protocols that we're all beginning to implement and live in this new normal? And then the last piece is also for each business to be able to address the transportation. You know, we are a united valley throughout 3 different counties, and so we've made the transportation elements to align across Garfield and Eagle County. So it's a 50% occupancy and maintaining that 6 feet social distancing within each of the vehicles. So, you know, really reducing the carpooling, but recognizing that in some needs we need to carpool and that we really maintain that 6 feet social distancing and 50% occupancy when it's not within a family unit. And so as each business goes through and looks to submit their safety guidelines per the roadmap, and throughout the entire roadmap document that Jordana alluded to, you will see each sector that needs to complete the safety checklist. And once you go through and complete it, you will be given the sign that is up on the screen. And again, this is the sign that shows to you, to your customers, to your employees, and to our community that you are taking this seriously, have submitted the protocols in place, and can open per our public health order. And that's really important, again, as we collectively move forward to reinforce that this is a safe place that we all can be to our visitors and to our employees. And so as people have questions, we know that there are lots and lots of questions that are emerging. We had a virtual town hall yesterday to be able to answer or at least hear specific questions per sector, seeking the clarifications as Jordana had spoken about earlier. There really is great guidance coming down from the state. We are learning just as quickly as each of you are and are trying to get the information available. So we are pulling together FAQs based on the guidance that we know so far, and are actually going to be hosting another open virtual town hall for businesses for further questions or clarifications, especially as they seek to complete these business safety checklists.
Kara, do you need us
And
to
so-
advance the slides for you?
No, this is the main
Okay.
one.
Got it.
Thank you. And so again, as everyone looks to complete the checklist, we'll be posting FAQs, especially as we hear more guidance. We'll be updating them regularly, and we'll be having these open virtual town hall meetings. And again, if there's any other questions or you feel like you need clarification, we've set up a business liaison at pickencounty.com. That's Andrew, I think that is on the next slide, actually, of how to stay in touch. One more. There you go. So if you have any question, we have a fantastic person that's helping us search through these and are building out resources to do the research necessary. So please direct any questions to Business Liaison. We'll be updating the Pickens County website, as Jordana alluded to, with updated FAQs, and as we all learn more, and sharing what we're collectively learning together as we move forward into this safer at home stage. And with that, I'll turn it back to you, Kelly.
Kara, do you mind if I ask you a question about this? Because we do have a little extra time. And I wondered, you know, for, say, a salon that will open this weekend, can you just illustrate what a customer might expect to experience when they go to get their hair cut?
Yeah, so there's various guidance for occupancy based on your sector. And so if you have any questions, we really need to look at the state FAQs. So salons are, and looking at Jordana to confirm this, a max of 50% occupancy, plus also maintaining that 6-foot distancing. So where there might have been 5 chairs in the salon historically, that might have been full. You might only see 2 of those chairs full at any one time. What you're going to see when you walk in is that there's probably going to be some level of a symptom check that you might have to sign off on to confirm that you are not entering sick, you are not symptomatic. You should be entering in with your face covering, as well as the hairdresser would have their face covering. And then once you move into that place, then you can get your hair cut just as normal, but while wearing the face coverings, and then can, as you check out, probably trying to reduce any of those shared contact points between the checkout point with your hairdresser and yourself. And then the other thing that you should see is that you should see the sign that was up on the screen earlier, that they have submitted a business safety checklist on file with Pickens County.
Okay, Jordana, did you want to add anything else for that question?
No, she was doing great. And what we're really learning is reading through the hair salons count as personal services. So I just went on to colorado.gov, Safer at Home, and am looking through all of the requirements for personal services, and it tells you about the workspaces, what's required for employees. It also goes through for those business owners, what the sanitizing requirements are, and many other pieces of guidance that are going to be specific to different industries.
Okay. And then I won't put you guys on the spot too much, but I will ask one more clarifying question about the changes we'll see on May 9th. So will this new order bring all areas of Pickens County under the mask requirement? Because we know City of Aspen passed an ordinance and Snowmass did earlier this week.
Yes, and the state requirement aligns that. So the state requires that when you're going into a place of business, you're wearing a mask. And then also if you're outside and can't maintain that 6-foot distance for longer than 10 minutes, that you're wearing a mask.
Okay, so don't leave home without it. Great. Okay, and I just want to check in, any other contributions from our panel before we wrap it up? No? Okay. Well, I want to thank you all for your expertise today, and thank everybody at home for tuning in. This is going to be, we're changing. We're starting to transition out, and your commitments to containment will be more important than ever. So please go ahead and just continue to comply with those. We're all in the practice of extreme hygiene now and bringing our masks everywhere we go, monitoring our symptoms, staying home when sick, and then getting tested. And so again, if you feel like you need to be tested, you have any symptoms, please call your primary care provider to get a referral to be tested. If you do not have a primary care provider, please call the Aspen Valley Primary Care Clinic And that number again is 970-279-4111. We also continue to have our Aspen to Parachute COVID hotline operational, and that hotline will direct you to any of the answers you may need. So please keep that at the ready. That number is 970-429-6186. And stay healthy, stay safe. We will all be together again someday soon, and I look forward to that time. Thank you, Grassroots. Thank you, IT staff. Thank you, Aspen Public Radio, for broadcasting this today.